Veterinary Surgical Centers is a progressive small animal veterinary surgical referral practice dedicated to meeting all of your pet care needs. And here with more is certified rehabilitation practitioner Kasey Braun. Lots of big words this morning, but we're talking about our dearest parts of our family, our pets.
Absolutely.
So rehabilitation, what is it, and does everybody need it, or does our pet have to be injured?
It's very similar to human physical therapy in a way that we use physical therapy techniques to basically improve the quality of life of the pet, improve their function, decrease pain, things like that. So very wonderful beneficial for the pets, whether they have surgery or whatever it may be.
So most of us are working professionals in Washington, D.C. Our pets are probably sitting in our houses 40 hours a week, watching TV, doing
couch
eating,
potatoes.
Whatever. Should we just bring them in for a little tune-up and see if they need something, or if there's something maybe lying underneath the surface?
Absolutely. It's good to kind of see, you know, a lot of times dogs will be very stoic and not show signs that they have a lameness or a problem. So it's really good if you're noticing different things changing in behavior, changes in appetite, things like, you know, acute lameness at all. That is definitely something that you would want to pay attention to. And then just looking at them and bringing them in, we can kind of tell you whether or not they need a little bit of weight loss or a little bit more fine-tuning of muscle conditioning, things like that.
Okay, let's talk about cats.
Cats.
How do you get a cat to do physical therapy?
It's actually, some of them do pretty well with it. Once they're in the environment, we have quiet rooms that we take them in, and they do better on a one-on-one therapy session versus anything that would deal with water, of course, and, and whatnot. So they do pretty well, though.
Okay, so how does a pet owner know now's the time we should bring them in?
Typically is by if you're noticing changes and seeing that your pet may, you know, if it's had surgery, if it's been not eager to do certain exercises, things like your changes in doing stairs, or if they're slow to get up, or they're not as eager to go for walks and things like that. That's when you would want to bring them in, have them checked out. We do several different types of assessments to see how they're doing, gait analysis and muscle measurements of their thighs and shoulders and body, just to see where they're at and see what condition that they're in.
What kind of pets are we talking about? We sort of are alluding to dogs because we think of like hip dysplasia and all the sort of things that dogs have. Some cats probably overweight. And
cats, mainly the overweight. Obesity is a little bit more common, especially in older cats. Things like, you know, dogs especially is really, you know, a big thing that we see because they can go in and they can accept a lot of the therapies that we do.
Okay, this video of the dog on the yoga ball, I mean, I have to, really? Is that
absolutely,
a thing?
Absolutely. It's
what
excellent.
Does it do?
Basically for balance and proprioception. So we're working on a lot of our neurological patients that are trying to build up back strength, core strength, things like that. We work them on the ball to build those types of muscle, those specific muscles, and then it kind of gives them it actually relaxes them quite a bit when they're on the ball.
I bet it's like spa day for the dog.
It is, yes. The underwater treadmill sessions and things like that.
Yeah.
Yep, it's warm water. It relieves the pressure of the joints, things like that. Is, you know, it's really, they accept it very well. Okay,
cats, dogs, what other animals do you guys work with?
I have worked with wildlife a little bit, and doing rabbits and things like that, small, you know, pocket pets and things. But mainly, mainly dogs and cats.
What's the big issue that you see that pet owners probably don't?
A lot of times hip dysplasia or slight lamenesses that people don't pick up on at home. A lot of times because of the winter, their dogs aren't exercised as much. They gain more weight, and because you see them every day, you may not notice that their body condition has changed. And then in the summertime, they come out, they go and exercise, and that's where they injure themselves.
They're just like us.
Exactly. It's the weekend warrior.
Now, I wish you had brought pictures of or a video of cats working out on things, because I just want to see that. But tell me what to expect if I brought my cat in. What would the day be like for her?
If you brought them in, basically what we do is we go through an assessment. We check them over, see what their body condition is, and then we go through a series of different range of motion for them, checking their joints, we measure their muscle structure, and then we set you up with a program that you would do at home, and then as well as discuss what we would do in the hospital. So it's really important that the owners are able to do some of the exercises at home, because then they can do it daily. It really helps strengthen that bond between the pet and the owner as well, so it's really essential to the rehab program.
Okay, let's talk about cost, because every time you take your dog into the vet, it's going to hurt.
Yeah.
So what about costs here?
It's fairly inexpensive, actually. We usually, the general kind of consensus for the rehab programs and initial consultations are around $150 to $200, and sessions range, depending on what the pet needs and the modalities that they would need, anywhere from $60 to $120, depending on what you're doing.
Totally worth it for a quality of life for Fluffy, right?
Absolutely.
Thank you so much, Kasey Braun, for telling us how to keep our pets healthy.
Absolutely. Thank you.
More Let's Talk Live's coming up. Stick with us right here.